Good morning, good afternoon, good evening, good night, wherever you are in the world and joining us. Today, we're commemorating our first anniversary since Black Mental Health Matters was incorporated. We will be looking at eradicating stigma in the Black community and embracing trauma informed care. And we have with us today Dr. Rhonda Bryant. Dr. Bryant holds a PhD in counselor education from the University of Virginia and holds credentials as a licensed professional counselor in Georgia and Virginia. She's also a nationally certified counselor with the National Board of Certified Counselors and has been awarded diplomat status in substance abuse and trauma counseling from the American Mental Health Counselors Association. She has practiced, she has experience, practicing with the Black community in the K-12 college community and correctional settings. Dr. Bryant, welcome.
Thank you so much.
So I want to start off with a quote from Mark Nepo from his book 7,000 Ways to Listen, Staying Close to What is Sacred. There are small pressure points of residual feelings that live in our bodies, small pockets of trauma that hold the sediment of the stories that shape us. And that, as I said, is from Mark Nepo. Dr. Brent, I'm going to start off by asking this very first question. What is your understanding of the word trauma?
Sure. So when we think about trauma, just from not even a clinical sense, but just an ordinary sense, as a kid, most of us have some memory of bumping into something, getting a bruise, and seeing like a welt rise or the skin turn different color. So when I think of trauma, I think of that hit, an injury, something that we may not have intended to happen, but has happened. So when we talk about trauma from a psychological perspective, we don't always see the welt or the raised bruise or anything like that. That's a lot harder to see.
I like your answer because what you've done is address the physical trauma. You bumped into something that is trauma, but then there's that psychological thing that can happen also. I like the way you've answered that question. So, what are the different types of trauma that we can experience?
So typically when we think about trauma, you think about acute trauma. Somebody has a difficult experience, and it is natural that a person is going to experience fear or disruption or something like that after. We also know that acute trauma can turn into chronic trauma that is long lasting, that goes well beyond that event that caused that initial hurt or the psychological hurt. And then we move to what's called complex trauma. And that's really a bit of what we're going to be talking about today, because complex trauma goes between, it's intergenerational, it crosses generation. There are elements of complex trauma that are not only in terms of our context, like our family, our society, like school, faith-based communities, but also that trauma that we can't see that becomes so complex. If you will, I can give an example. It's like having a beautiful ball of yarn that you want to make a beautiful sweater from, but the cat has gotten that ball of yarn, and now the cat is batting the yarn back and forth. And so that beautiful sweater that we envisioned, which is a healthy mind, is now tattered and torn. It has cat spit. It has all the dust bunnies in the corner that we didn't get. And it's a tangled mess. And we're left thinking, how am I going to untangle all of this? Right? So we give it to the next person, and the next person gets more and more tattered as we go along. So I hope that's a good analogy for what we're talking about.
I like that analogy because I remember in the same book that I just quoted from Mark Nepo, he spoke about that, but he used the fishing net, untangling the fishing net, So I am familiar with the tangles of life, how things can get a little messy, and that as therapists, what we do is help you to untangle those things, make it whole, make it back to what it was before.
Mm-hmm.
So I do like the way you brought that analogy. That is perfect.
Thank you.
So I want to go to my next question, and this is a question that's very dear to me because I honestly think that trauma, if not treated, lead to other physical illnesses, especially psychological trauma. And I want to find out from you, would you say that trauma is psychosomatic, or is it just a mental and emotional thing that people go through?
So this is a really important question. So, I know that you have a great audience, and if they're cleaning or doing something else, I want everybody to stop and listen to this answer. Because for us as Black people, right, we have legitimate mistrust of societal institutions. It goes way, way back, generations after generations. And we also know that culturally, particularly around gender norms, it is not acceptable to say, I am feeling sad, or I'm feeling weak, or I'm feeling unhappy. What are you unhappy about? You got food, you got clothes, you got a place to stay. So we don't always have a space to acknowledge or even label those feelings. So what do? My stomach hurts, my head hurts, my back hurts, because we know we carry stress, people, humans, in our bodies. So when we talk about psychosomatic is a word that basically means that people are somatizing, they are feeling their psychological stress or trauma in their bodies. And in the worst case scenario, that psychosomatic illness really becomes an illness where we know that some of the illnesses that are stress related, high blood pressure, some cancers we know, heart disease, things like that. So it's a really good question, because psychosomatic can mean a physical manifestation of a psychological trauma or injury, but left untreated, and stress left untreated, we know causes physical problems. So it's a great question.
Well, thank you. Can you identify some of the key traumas that affect Black communities in terms of economic success?
Um, One of the biggest traumas, I would say, is redlining. What we see was done in the 1950s in President Eisenhower's highway system, right? Where we had the highways, because we don't always have highways in our country. So what the government did was they came in and they took homes from Black people. They took homes and they redlined them and forced them into unsafe, not up to code, very poor living conditions. And we saw it in Detroit. Dr. King, I think, went to Detroit to Chicago and said, I saw racism in the South, but I've never seen it as bad as he did there. So I would say to you that this systemic oppression of Black people that denies us good, safe housing, access to quality medical care from even before birth. I think those are significant traumas that affect us, and because if you don't have a place, we don't have a safe place to stay. We see that interrupts everything. So I would say that.
So, what do you mean when you say we don't have a safe place to stay? Because I
Sure.
know the Caribbean experience is a
Mm-hmm.
bit different
Yes.
to the American experience because of the population difference. Where
Mm-hmm.
within the Caribbean we have like a 95% Black population and a 5% of the others, which is mixed with Asian, Caucasian,
Mm-hmm.
Indian, and others.
Mm-hmm. So when I talk about a safe place to stay, first we can start with the physical, right? If people need access to clean water, they need access to good, healthy food that's not been treated with chemicals, right? How do we get that? I can certainly say for me, growing up in America, even though my parents came from the South, I don't know how to grow food. If something happened right now, like I know how to go to the grocery store and get food. I don't know how to grow my own food. So having access to clean water, healthy food, um, having access to a living environment where children know that they're safe, that even if they're home environment, because everybody doesn't have a safe home environment, but to be able to go to school and know that they're safe at school, to talk about that home environment. Many of our children don't have any safe place to just be children. My husband often talks about growing up in New Jersey and having to go through metal detectors, right, going to school. And so I used to work in a prison. And so every day when I went to work, I had to go through those metal detectors. And at some point, we have institutionalized our children so much, they don't even question why they're going through the metal detector anymore. They don't question why they have to have clear backpacks. So I'm glad you asked me to clarify. So having a safe place to just be who we are and feel what we feel, particularly as Black people, is elusive for many of us from childhood.
I like where you've gone with that because I'm thinking that you talk about a safe place, but some homes are not safe for young people because of the parents.
Mm-hmm.
And in some cases, you might find two or three generations living under the same roof,
Mm-hmm.
carrying the same pattern of behavior. How do you address that? I mean, and that's something that you'll see here in the Caribbean as well, where there are pockets where you have several generations living together.
Mm-hmm. I think there has to be a safe place where parents can say, I don't know what I'm doing. I need some help. I think our societies frown on that. And we can't criminalize poverty, right? I've gone with people to appointments where they get government sponsored food, or like WIC in America, or the food and the cheese or food stamps or something like that. And the way that folks are treated, you can't have a car that works well, because if your car is worth too much money, you can't get help, right? But you need a good car to get back and forth to work. Internet is extremely expensive, and in some rural areas, people can't get internet. They don't have good service. So, be have for families to have a place to say, I don't know what I'm doing with this parenting thing. There used to be a time where we could go to aunties, we could go to, uncle and say, I don't know what I'm doing here. Can you just help me? But now I think we have a place where we know that if we say that, some families are likely to get their children taken away by social services, and we know that children are re-victimized by
Mhm.
by foster care, some unscrupulous foster parents, and the system that takes them back, takes them from place to place to place. And there's a whole body of literature right now about how the child welfare system has decreased the stability of Black homes in particular, and how it has failed the children in those systems. So, to circle back to your initial question, if socially we had a place where people could go and say, I need help with parenting before they get into trouble and start getting into physical abuse or emotional abuse, or not being able to provide for their children, we might, without losing their children unnecessarily, we may we might see that change just a bit.
Yeah, I understand that. Um, what I'm going to say is that, and I wanted to look at how domestic abuse can impact on
Mhm.
generations, you know.
Mhm.
So, and I think that's what I was trying to pull out. Safe home, because you think you have a mother and a father, but you're living in an environment that is so turbulent,
Mhm.
you know. So for me, it is like, how do I, or how do we help children in those situations where there is that trauma happening every day, parents
Yeah,
beating upon each other, being abusive to the children for whatever reason.
it's really interesting that you asked that, because I do have work. working with domestic violence survivors and men who were perpetrators of that domestic violence. And it's, you ask a tough question
Mm-hmm.
because there are resources for people to get out. But we also know that for that mother who wants to get out, or that father, and usually we see it with women. We are seeing some same-sex domestic violence as well, where these couples also have children. But the challenge continues to be, how do we get one party out, get the other party the help that they need, and in doing so, preserving that both parties, the both adults' mental health and the children. The unfortunate part and the subtext of what you and I both are saying is that the children don't have any say so. An adult can decide whether they want to leave or go, and even live with the consequences of that. But it is very difficult. And this is where our schools, I think, really come into play. If we have trained school counselors, I have a couple of friends. One dear friend is from Jamaica, and another friend is from Barbados. And my friend from Barbados is actually an international school counselor. And she does work with children all around Africa and all over the world. And one of the things that I find when I talk with them is that there's some cultural strengths that schools don't capitalize on. We're talking about working with children in these domestic violence situations. We are quick to go to external, like foster care, things like that. But there are some family members who are not caught up in that kind of violence and can care for the kids while still maintaining those bonds of kinship. And so how do we get our social and legal systems to take advantage of those resources, those cultural strengths, because often they're ignored. But our school counselors should be able to help, our school psychologists should be able to help. And one recent development is mental health in the schools. And so that means that the students can get their counseling right at school during the school day, instead of waiting for the parent to have to take them to an appointment, outside and all that. So that is another option. And unfortunately, what happens is that many times when the violence is really bad, families will move from one district to another to avoid taking responsibility for what happens.
Wow. That's interesting, because you would think that I'm a parent, and for me, my children being safe is my ultimate goal, making sure that the girls are always in a safe place, not just physically, but psychologically and emotionally. Because I think that that helps to shape who we become as adults, how we show up in the world. So for me, you've answered that question really well, but I didn't realize that, there was so much happening in the school systems where you can have that counseling happening. But I still think that parents need to be counseled too. And that is
You
where we
know,
get the biggest challenge.
yeah, LeBron James, of course, the basketball player, started the school. I think it's in Chicago, where the parents can get their GEDs, where they can get counseling on demand, they get financial counseling, they got all that. And when he set the school up, some critics were like, well, he's not an educator. He needs to stick to playing basketball. And what we're finding, even I think 3 to 4 years later, the students continue to do well. The parents are doing better because the school is embracing the community. The school isn't treating itself like it's a community. The school is not treating the parents as outsiders. It's embracing them where they are. You don't have your GED? Come here. We got GED classes at night. If you need financial help, come here. They've got washers and dryers in school. So if the parents don't have water, or you don't have access, to a laundromat, they can wash their clothes at school. So until we really begin to focus on building community and meeting parents or caregivers where they are, where people, which is the whole purpose of your important podcast today, is eradicating that stigma. I know what it's like not to have money to go to the laundromat. I know what it's like to not have money, and it's okay. It doesn't make me a bad person. It means that I just didn't have a lot of money at that point in my life, right? And so grandmama used to say, some of y'all will sneeze away from the poor, get laid off from the job, that savings that it takes 10 years to build up can be gone in 10 months, right? So I think that the the tenuousness of life sometimes escapes people as we look at others who may not be doing as well as we are.
Yeah, I like how you've answered that question. And it shows the level of I'm my brother's keeper, especially in that school setting, I'm my brother's keeper.
Mm-hmm.
And it comes back to that concept of oneness, you know. If you are unwell, then that means that I'm going to be unwell at some point in time. May not happen
Mm-hmm.
now. But if a society doesn't find that healing, then you're going to have so many other challenges going forward. And I know, like the Caribbean, that most, and I want to say most Black Americans have been affected by slavery. What are your views on post-traumatic stress slave syndrome? Do you think that is still affecting us today?
Oh yeah, oh yeah. This is absolutely. I got a chance to hear Dr. Joy to hear Lily speak about her book, and it was fascinating to hear her talk about and connect the intergenerational effects of trauma on our bodies, on our minds. So, for example, we know that Black people here in the United States and in the Caribbean are more likely to get high blood pressure. I mean, yeah, and we know, and biologists have said this is because of the Middle Passage, right? That they're because they weren't getting enough water and weren't being cared for, that our genes and bodies literally adapted to retain water. But the side effect of that, of course, was high blood pressure, hypertension. This is why it's disproportionate in the Black community. So we know that that collection of systemic and societal oppression all over the world, because what I know, and you know, in America, we don't always learn about enslavement from other cultures. It's a fight to learn it from American perspectives, because I'm sure you're aware of all the brouhaha about teaching critical race theory in schools. But what politicians are calling critical race theory is actually just American history. It's not even Black history, it's American history. And a lot of us don't even have any concept of what happened to those Africans who were taken to the Caribbean, and the horrors of enslavement around the world. So that's the 2 or 3 minute answer. But absolutely, I believe that her theory is accurate and very applicable to our lives today.
Okay, that's a great answer. I would have liked to go more in depth into that question, but I
Okay.
think that's for another forum where we can really
Okay.
trash
Okay.
that one out and show how that is still affecting us today in terms of where we work, in terms, as I said before, our health, in terms of our psychological well-being. Because I know in the Caribbean, we still see or we still talk about a situation where I can't achieve because one group of people have all the financial resources. And we keep looking at ourselves because I'm Black, I can't move forward. So that is a topic that I would definitely like to trash out in a
Sure.
different forum. Yes.
Sure.
So would you say that trauma, and this is coming back, I think you answered this from generation to generation, you know, like I may have experienced abuse as a child. Do you think that my children, and I'm not saying my children per se, but children attract to themselves the same patterns that they would have picked up from the mother, and not necessarily outside of the womb, but let's say, for argument's sake, that while pregnant, a woman is being abused by her partner or someone. Do you think that that trauma can be passed on from the mother to her unborn child, and then as the child grows up, the child acts out and carries that trauma?
So there's a couple of points I want to make. This is a really important question. So we know that trauma actually literally changes the brain. We know it changes our brain chemistry. We know that it causes the release of certain neurotransmitters. It changes our blood pressure, and it activates our fight or flight response. And scientists actually know that women who are pregnant, who are being abused, that those release of those neurotransmitters in response to the abuse, we know it has an effect on that unborn child. If you take that plus, if that woman is using alcohol or marijuana, which is both very easy to get, um, or if she's smoking, all of those things combined, we know have negative influences on that fetus, that child's in utero development. What we don't talk much about is how that stress and trauma also changes men's sperm. So by the time that if a man gets a woman pregnant, his sperm is also changed, the trajectory, its strength, its ability to translate the genes into the egg. We know that their sperm is changed by the trauma response. So we spend a good deal of time talking about the child in utero and the effects of stress and trauma on the mother. We don't spend as much time talking about that because it makes sense, right? The mother carries that child for months, and the father, contributes to sperm. I mean, for that part, his part is done, right? But we know that both really do have an effect. Here's where it gets really interesting. We can change that child's brain chemistry. When we teach children how to label their feelings, when we teach them constructive ways to manage anger, and here's where I think in the Black community, this is where we have gained some adaptive paranoia that has kept us alive. So I'm not sure if you're familiar with comedian David Alan Grier. He was on In Living Color. Well, David Alan Grier's father was actually a psychiatrist who wrote a book called Black Rage in the 1960s. And in that book, the book is by Grier and Cobb. You can get it on Amazon, anywhere. But it was such an important piece because in the book, Grier and Cobb talk about this healthy adaptive paranoia that Black people have that keeps them alive. So I'll give you an example. When I was growing up, my mother would give us all the speech. She would line us up at the door before we went anywhere. This is what you do. This is how you act. Don't touch anything. If I look at you, you better be ready to move. Don't make a sound. And, I was not alive when Emmett Till was killed, but what happened to Emmett Till in Mississippi shaped my childhood because somebody said he whistled at a white woman and he was killed because of the allegation, right? So something as simple as you better keep your straight face when you walk out this house or else. We learn early being Black can get you killed. I did anyway. That being Black can get you killed or harmed. And so what does that do? Even if you have a child who's growing up in a loving, caring home, what message does it send that you can't touch things when you go to the store because somebody might think you're stealing? Well, how do children learn? They're tactile learners. They touch, 2-year-olds touch everything that goes in their mouth. I mean, so part of the messages that we even give our children just to stay alive in oppressive societies diminishes their development. And that's not our intention. We don't mean to do that, but we've had to do that to keep ourselves well and healthy. Does that make sense?
It does. It does. But for me in the in the Caribbean, even though we would have similar instructions, I think it came from a place of not shaming your family by doing things
that part too.
Yeah, not
That
shaming
part
the
too.
family. But here in the Caribbean, as I said, there's a difference in the numbers for Blacks as it is for whites. So,
I'm sorry.
so the idea that a white person would kill us because of our color is different for us. I think they don't trust us either. I honestly think that they don't trust us either, but they handle the situation a little bit different. And I think they handle it different because if you're in an economic society where 95% of your customers are of a different color, you want to keep them as comfortable as possible. But by the same time, you want to keep them oppressed as well. Because what happens if we decide I'm no longer going to shop with a particular store because it is owned by Caucasians? We can turn the tables around economically for the small population of those who control the island's wealth. So I think they tolerate us on a different level
You
because for
know,
them, we are their money still to this day. We are their money. We how they generate income. They need that 95% population um, to take them to the next level, to keep that old plantocracy money floating around, so to speak.
it was interesting
Um,
to me when William and Kate came to Jamaica and some of the folks' response to their visit. And taking Queen Elizabeth off the money. I grew up in Washington, D.C., and the city was 95% Black when I was growing up. Our mayor was Black, I mean, everybody was. And so when we heard about these traumatic things that happened in families and things like that, there wasn't that added element of, oh, and you know they're Black. It was just like, oh my gosh, did you hear about what? And it does something psychologically to remove that because once I left DC and went to spaces that were not primarily Black, that's when the other things started to kick in. So you raise a really interesting and important point about that.
so this is the major part of our discussion today: trauma informed care.
Yes.
Can you share with our audience what this is and why it is important in our communities?
Sure. So trauma informed care is a term that basically means that when we interact with people, we should, and I'll define the we in just a minute, we should assume that there is some type of trauma, acute, chronic, or complex. So remember, reminding our viewers, acute means something that just happened that the person is dealing with and trying to recover from. Chronic means that acute trauma has now gone on longer than we might expect for it to, based on what happened. And you've got that complex trauma, which you're talking about. This is intergenerational, and can go from mother to child and grandmother and all kinds of context, social and familial context. So when we talk about trauma informed care, we're talking about care that treats people with respect and openness, that assumes that there is some trauma in their background. We do not assume that there's trauma, but we treat them that way because we don't want to inflict more harm on people. So when I say we, there's several fields talking about trauma informed care now. Medicine, certainly the field of therapy. So I'm a licensed professional counselor, but social work is talking about it. I believe our religious colleagues, our religious and spiritual healers are talking about this trauma informed as well. So it is an approach that assumes that people have had some type of trauma, and we want to act in ways that affirm their humanity and their well-being. It does not add trauma to what they've already been through.
Well answered. I'm going to go to the question of, as a therapist, you're meeting a client for the first time. Can you share with me what is the best approach so as not to trigger the client? Because I'm meeting you for the first time, and as you say, you assume that there's some sort of trauma. But as a therapist, I too would have experienced trauma. And I might very well say something or do something that triggers your trauma because I'm carrying, and I find sometimes as a therapist, we don't do enough continuous work on our own healing.
Mm-hmm.
So we may go into a session and carry something over to someone else. What or how would you suggest that we approach a situation like that?
I think a therapist that I just met recently has a really good way of doing this. And what he does is he sets up a consultation with the potential client before they start a therapy session. And in that initial session, that therapist will talk with the client, potential client, about what they hope to get from therapy, what they're looking for. He essentially puts the therapist in the driver's seat to talk. I'm sorry, he essentially puts the potential client in the driver's seat about what they want from counseling, what they know about counseling, because people don't always know. They think they're coming to us for advice, or they've watched too much TV and they think that what they saw Dr. Phil or Ayana Benzant do, right? That's what we do. Is not all of us operate that way, right? So he puts, excuse me, the client in the driver's seat by allowing them to talk about what they hope to get from therapy, what he brings to the experience, and he's very open about his own recovery from trauma as growing up in a very difficult family home. And he talks a bit about, not too much self-disclosure, but talks a bit about the work that he continues to do to set good boundaries and take care of himself. And a lot of people who have experienced trauma have never been placed in a position of being in a driver's seat. They've always been told what to do, when to do, how to do it, and how to act. And so giving up that perceived position of authority and power as the expert, right, goes a long way to bringing somebody on board, even before we, contract and sign paperwork with them. I've worked in counseling centers before. We bring somebody in, here's the paperwork, fill it out. Okay, great. What can we talk about today? And he slowed that down. He's in private practice, so this is how he makes his living, right? He slowed it down and put the client back in charge. And I think that is a great way to work with someone who's experienced or is experiencing trauma.
I like the answer that you gave, because that's something that I can borrow for myself as a spiritual practitioner going forward, that rather than I come across as, look, I know what is best for you, you tell me your story so that I can journey with you and not necessarily be the person who's in charge and saying, well, look, you got to do this, you got to do that, but allow you to tell me where you want to go and how you want. So that question was really well answered. Thank you so much.
Thank you.
Yeah. One of the other things that I thought about, you grow up as a child and teachers are not aware of the trauma that children carry and tend to punish, especially in the Caribbean. We still do punishment. I don't know what it is like in the USA, but we still punish. And teachers often just punish you for being a child who's carrying trauma and does not know how to express, does not know how to say, well, look, I'm living in an environment where my parents are constantly fighting. I'm living in an environment where there's so many people in the house that I have nowhere to sleep at night, or the issues with food. There's so many things going on in my home environment. So yes, I come into the classroom and I'm acting out but then that trauma is being compounded by this child being punished. How or what are some of the ways you think that this can be addressed so that children can start their healing at that stage rather than be punished for the trauma that they carry?
Mm-hmm. So I'm answering this question like a former K through 12 teacher and a school counselor. And we need training in empathy in order to really address this problem. We really need to look at how we train teachers to go into the classroom, who's training our teachers to go into the classroom, who gets to be a teacher, because I'm old enough to remember that I had nuns for teachers, but my teachers who weren't nuns wore suits to work, hose, heels, pearls, like every day, right? Even if it was the same suit, there was this belief that being a teacher was an honorable and really sacred way to care for children. So I offer that not to criticize too much about how we train our teachers, but I've worked in colleges of education where we train teachers and principals and counselors, and empathy training is not a part of that. It's about rules, it's about standards, it's about curriculum, it's about pedagogy. But how do we get teachers to slow down and think about these are little humans, right? I also think that once teachers get into the field, that we need to, in much the same way, and medicine is changing, in much the same way that medical schools are hiring positions of vice presidents of empathy, vice presidents or trainers, counselors who work, therapists who work with medical students to prepare them because everybody doesn't understand empathy. They're not naturally empathetic, but there are ways we can teach people about empathy. So I know that's a bit of a long answer, but I think the only way we're really going to be able to change that is to change how we teach, how we prepare teachers, how we assess teachers, because teacher assessment is very much driven by outcomes. It is not driven by relationship or community. And we do have teachers who do that, right? They're excellent at it, but it's not always rewarded.
Excellent. In raising the awareness of trauma informed care, not just for therapists, but for persons who, let's say, the HR manager, people who actually have to interact with people, do you think that it is important to understand a person's history, where they're coming from?
I think
In the
it's important.
workplace, in the school, is that important? Because you're dealing with issues of confidentiality here.
I do think it's important to understand, but I will go back to my comment about empathy. So I'll give you an example. Uh, Suppose a supervisor has a staff member that's coming to work late, all the time, just late, late, late. When they're there, they're on the phone, they're distracted. A supervisor going in and saying, "You're late. The policy says this. It's not okay. You do it again, you're fired. Sign this contract." That the supervisor is within their rights. A different supervisor can go in and say, "Hi, I noticed you've been late. Is everything okay?" "Everything's fine." "Well, let me tell you, just in case it's not, here's the number to the employee assistance program," because most companies, most schools have that now. "And if not, these are some people you can talk to, and they can tell me what you're talking about. You can talk with them privately. How can we get it so that you're coming to work on time? Because if you continue to do this, it's going to be problematic, and I want to help." Training our supervisors to be empathetic and not so rule bound, it goes a long way. The other part of that is that threat to self. Sometimes when we're in positions, we meaning humans, in positions of authority, we like that authority. We want to make sure nobody's going to flout that authority. So we flex when we don't need to flex, as if someone not following the rules is an affront to our leadership or our managerial skill. So getting that supervisor and that HR manager to do that work with that new supervisor or experienced supervisor, right? That says, when you have an employee, just like that kid in class, who's acting out, what's going on with your employee? I love to give the example. When I was training teachers and school counselors, I would say to them, so picture this. You're teaching fifth grade. You got Whoopi Goldberg in your class, Madonna, Prince, Bob Marley, and some of his band with him. You've got Jim Carrey, and who was the other person I used? I can't remember who it was. And I said, you got all these students in your class, plus the other 15 students. You got 20 students. Prince is running around in high heels and tights, screaming. Whoopi Goldberg is telling jokes, right? Bob Marley just wants to play his music. He might be smoking a joint. I mean, really, and so it gets them to think about who these people are. Oh, the other person was Richard Pryor. Almost everybody I named brought trauma with them, and that's why they're so successful in their careers. We don't think about their trauma now, but we know Richard Pryor was someone who lived with horrible trauma growing up. So that's a long answer, but empathy training for our leaders and managers can go a long way in just helping them understand this is not just an employee, this is a human.
I agree with you there. Yeah, you meet people as human and recognize that as human we have so many challenges. And in order for us to have harmonious relationships, we really need to seek to understand where the other person is coming from rather than push ourselves on them and say, well, this is the right way to be. You're acting out. You don't behave well. You don't dress well. I once spoke to a lady who was sexually abused, and she said to me, for years, she would just wear baggy clothes, clothes that hid her beautiful figure. And that's a way of handling the trauma of that experience, you know. It
Mhm.
took her a while to realize I did nothing wrong. That's on that person.
Mhm.
And come to that place where she started to feel comfortable enough to wear her makeup and buy sexy clothing and wear.
Mhm.
Trauma can affect us in so many different ways. And
Mhm.
I know that for a lot of people, there's a myth that children are resilient, but children are not resilient because they carry that trauma. And it's at this juncture that I would like you to share some of the ways in which we can educate our communities in our effort to destigmatize mental illness.
Mhm. I think that integrated care is so important. And by integrated care, what I mean is, um, if I had my wish, um, I would, as a therapist, my office would be right next to the doctor's office, right next to the dentist's office, right next to the lawyer's office, right next to social services, where we co-locate all of our services, so that doctor can say, okay, now, patient so and so, we've talked about this. Your child seems to have the symptoms of ADHD, but we're going to send you across the way next door to talk to the therapist, to talk with you about possible pharmaceutical responses to ADHD. Or if you're not comfortable with that, we can also get you to talk about some behavioral responses and charting and things you can do at home and at school. We segment our care so much in our society that it's a hassle to get anywhere. So the way that I think we can address and reduce stigma is to make it visible, right? Kind of like the person you were talking about, who has this beautiful figure but is hiding behind baggy clothes and just wants to express herself, right, in a beautiful way, in a different way than hiding in baggy clothes. We tend to hide therapy, right? We don't talk about it. We don't celebrate it. I know for me, folks in some faith traditions have said to me, well, people don't need pills. They don't need that. They just need to pray. But what happens to the person who prays and it doesn't move their symptoms? So now we've added another layer to that person's trauma, which you talk about trauma informed. So I think one way to destigmatize is to bring therapy out into the open, and begin to treat mental health like we treat medical health. And we still have stigma about going to doctors in our community, right? It's very gendered. We know that Black men tend not to go to the doctor. And when they do go, right, their symptoms are so far gone that the preventive care that they could have gotten, often they're well beyond that. So that's destigmatization, I think, also is related to medical care, dental care. And the other piece, if I can, what you're talking about is elimination of health disparities too, right? Because if somebody has an extra $2,000, they can go pay cash to a doctor, a therapist, not have to get approval from their insurance. They don't have to go to somebody that's approved by Medicaid or Medicare. Here's cash. I picked who I want instead of being given a list and saying pick from these people. So I think that if we can move healthcare into the forefront in the Black community, prevention, coupling that with medical care. When grandmama goes and gets her diabetes medicine, because we know it's so prominent in our communities, that we also have somebody there who does a mental health assessment and check, because grandmother lost her husband a few months ago and all the kids are away and she's living alone. Building that integrated care in goes a long way to destigmatizing, because we make it normal. Are you feeling sad? You are. Well, it's normal because your husband passed away a few years ago. We've got somebody next door you can chat. It's all right here. We'll walk you over.
I'm glad that you touched on the financials in your talk because I think that that is a major factor for a lot of people in terms of seeking mental health care. If your physical body is going wrong, you want to fix that. But
Mm-hmm.
mental health may be, oh, well, and as you said earlier, someone may say, look, just pray about it, get involved in some religious activity. But from
Mm-hmm.
where I stand, I know that that is not enough. that can only compound the challenges. And I've seen that with one of my cousins who was schizophrenic. He just delved into the Bible and became worse as a result of that. So I'm saying
Mhm.
that in order for there to be a better addressing of mental health issues, we need to have the financial resources so that persons can get that treatment.
Yeah,
I,
I'm sorry.
I know when people go to the therapist, they think, oh, that's a lot of money just to sit and talk. But we don't have a problem going into the doctor's office for 5 minutes. You sit there for hours. The doctor will see you for 5 minutes and charge you $120, and we don't have a problem paying that. But to pay a therapist that same amount of money for 45 minutes to an hour becomes an issue.
It is. And there's a piece of this that people don't know how to find a therapist. Like we talk about it like, okay, I'm going to Target. There's a Target or a Starbucks on almost every corner. How does somebody know how to choose a therapist? Do I want an LPC? Do I want a social worker? Do I want a nurse practitioner? Do I want a religious and spiritual, healer or guidance, right? They don't know. So that's the other piece of this. We tell people to go to therapy, but we have not demystified how somebody goes about that. If you're fortunate to have insurance, you can call, but I've called, and the first questions they ask are, okay, Rhonda, are you in a safe place? Are you feeling like you're going to do something to hurt yourself? Are you going to do something to hurt somebody else? I know as a therapist that is standard protocol. The other person on the phone is like, oh, they think I'm fixing to kill somebody. I'm hanging up now. I mean, click. So we don't really have a way to socialize how to get a therapist and then how to say, this therapist isn't working for me. Like this isn't a good fit. They may be good. I need something different. So there's a level of information and preparedness that goes into choosing a therapist and finding the right person. It's like when people go to a bad restaurant. I mean, I'm sure, most of us have an experience going to a restaurant, like a chain restaurant that's not good. And I've been to McDonald's before and said, that McDonald's is horrible. But I've not said I'm not going back to McDonald's. I'm just going to pick a different McDonald's because I like McDonald's, right? So, that is also part of this too, right? And helping people understand how to choose. We don't make it easy. There was a study done a few years ago with a psychologist actually did this study where she had actors, black actors and white actors, and people with black sounding names. And this is her words, not mine, with names like Keisha or Malik leave messages on therapist phones. The therapist would not call those potential clients back. Like it was statistically significant, the number of black sounding names of people the therapist never called back. That's deep. And that goes to our training and what we're preparing our folks to do when they go out to become therapists.
From what I understand, there is a need for Black therapists in Black communities. I have a colleague who has been working from Barbados with people in Canada because they cannot find someone like them who understands their culture. You migrate and then you're looking for someone who can identify with you as a Black person, with you as a Caribbean person, and your culture, and the kind of experiences that you would have had. But where you're located, the therapist really cannot address some of your issues other than what they've been taught theoretically from books. But when you come to a person of color and you can identify with, yeah, I can see where you're coming from because that has been my background. I know what the culture is like. We have a comment from Latoya Gordon where she says, we need to normalize checking on mental health just as we have checking on physical health. And I really like that. Thank you, Latoya, for that contribution. And I think that is very important that we go to a therapist and say, you know what, I'm not thinking right, I'm not feeling right emotionally.
One of the organizations that I'm with, that I'm certified through the National Board for Certified Counselors, we have a whole minority fellows program where we actively seek people who identify as Black and other minoritized communities to get their master's degree and their doctoral degrees in counseling. The organization is also working with someone from the Virgin Islands to get national certified counseling in the Virgin Islands, because I think there's some differences with the psychologists and who's in that mental health marketplace. So there are so many opportunities for people who want to become therapists to do that. The challenge that we have is getting folks to apply and letting them know that that money is there, and getting a cohort of mentors who mentor those students, because we're Black in those spaces going through school. And I can tell you that it is not easy to be Black in those spaces and hearing about the way that psychology has been used to oppress Black people in many, many different cultures, right? So there are opportunities there available for people who want to become therapists. And I think also, as we work with our students in high school, encouraging them to pursue those careers and not dissuading them, for the more traditional, like engineering and things like that. There's good work to be done.
And I agree with you there that there's a lot of work to be done. It is at this point I would ask you to just give me a brief summary of how you see the eradication of the stigma in the Black communities as it relates to mental health issues, as well as getting people to that place where they embrace trauma informed care, especially Black people, where they get to that place where they are okay with trauma informed care.
So the easiest thing right now is for everybody who's participating in this, if we just tell 4 or 5 people to tune into your podcasts and follow this topic along the way. We've talked about a lot in this hour, but we can be the best messengers. We have influence with people who love us and care about us. And so taking this message to them, hey, I know a podcast, here's a book, take this, read this. Being messengers, I think, can go away to eradicating that stigma. As we feel safe using our own stories. I'm a survivor of depression, and even though it's been about 20 years, since I've had serious symptoms, I'm always mindful. I better get my rest, because that's really not good thinking. And I don't care what the house looks like. I've got to stop. I've got to go do this to take care of myself. So being not just messengers, but ambassadors where we can, and not being afraid to share our own stories as we feel comfortable about how we've overcome mental health challenges and what worked for us. In terms of trauma-informed care, I think one of the most important things that we can do in our roles is really, I challenge doctors and folks that I come in contact with. I don't carry the doctor, like the DR on my chest, it's not necessary, but I will challenge them when they're acting in ways that are culturally incongruent or disrespectful and stigmatizing. So I'll give you an example. I recently had a conversation with a doctor about a family member, and the doctor used a word that my other family members didn't know. And I said to him, what does this word mean? And he said, well, it's clinical. And I said, what you're doing right now is you're using words that nobody on the call knows. And you're serious, and nobody's going to say to you that they don't know, because they don't want to come off like they don't know. So we're possible holding folks accountable, not being unnecessarily difficult, but certainly challenging where we see behavior that is not trauma informed, and taking the opportunity to educate those around us. The last thing I would say, on a more systemic level, where folks are able, get involved in your communities. If that means volunteering somewhere, not just providing services, but with policymakers. A lot of us are providing treatment, but we're not in spaces where folks are making policies that add to the stigma of mental health treatment and lack of trauma-informed care in the Black community. So that would be the last thing that I would suggest.
Well, thank you so much. It has been a pleasure having you
Thank you
on.
so much.
Very informative. I have learned a lot, to the point where I'm like, yes, there's some things I have to do research on. One word that came up for me is the word redlining. I've never heard the term before, but I'm glad that I now understand a little bit about what redlining is. I want to say a really, really warm and heartfelt thank you. This has been
Thank you.
informative. And I would love to continue the conversation again, especially on the topic of post traumatic stress slave syndrome.
Absolutely. Anytime. Thank you so very much.
You are most welcome.